Hi, my name is Rebecca McAlpin. This presentation is for Maryville University, Nursing 612. This is my head-to-toe video on my patient Michael. Prior to Michael entering the examination room, I had him empty his bladder and put on a patient gown. Following that, basic measurements including his distance vision with the Snellen chart and near vision with the Rosenbaum chart were obtained. The vision test tested cranial nerve 2, his optic nerve, which was intact. First, I'm going to start by inspecting Michael's head and face. The head is round, normal cephalic, upright, and still, free of any tics. The skin is clear and intact. Palpating the scalp and the head, no tenderness, no deformities or depressions noted. Scalp is mobile, non-tender, free of any nits or scaling. The hair is evenly distributed. It is brown, smooth, and does not fall out easily. Palpating the facial bones for any tenderness, none is noted. Palpating the frontal sinuses and the maxillary sinuses. And now palpating the temporomandibular joint. Go ahead and open and close and move side to side. Excellent. Next, we're going to be assessing some of Michael's cranial nerves, starting with cranial nerve 7, the facial nerve. Go ahead and raise your eyebrows, close your eyes tightly, puff out your cheeks, smile, and stick out your tongue. Excellent. So symmetry of the face noted. Next, we'd be assessing the sensory portion of cranial nerve 7, which would be having the patient differentiate between sweet and salty taste on the tongue. At this time, we could assess cranial nerve 9, the glossopharyngeal nerve, by having the patient differentiate between sour and bitter taste on the tongue as well. Moving on to cranial nerve 5, the trigeminal nerve. First, I'm going to palpate the temporal masseter muscle for tone. Go ahead and clench. So good. Bilateral tone noted. Next, we'll have the patient differentiate between sensations. Just close your eyes and let me know when you feel me touch your face.
No. 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 No.
Excellent. So cranial nerves 5, 7, and 9 are all intact. Moving on to the inspection of the eyes. The eyes are symmetrically placed. Eyebrows are present bilaterally. Hair is evenly distributed and extends past the temporal canthus. The eyelids, when open, cover a portion of the iris bilaterally. Go ahead and close your eyelids. Eyelids shut completely. No signs of any tremors, redness, or flakiness to the eyelids. Palpating the eyelids, they're free of any nodules or tenderness there. The orbital and periorbital areas are free of any redness or swelling. Inspecting the irises, they are bilaterally brown. The pupils are both equal and round bilaterally as well. Go ahead and look up. So inspecting the sclera is nice and white, and the conjunctiva is pink. Palpating his lacrimal apparatus, no excessive tearing or exudate present. Next, I'm going to be assessing some of Michael's vision, so move it toward me. First, with his peripheral vision, go ahead and let me know when you see my wiggling fingers.
No. No. No.
Excellent. Next, I'm going to be assessing his pupil responses, direct and consensual. So go ahead and look right at my nose. First direct, and then consensual. And again on the other side, direct, good, and consensual. Excellent. Next, we're going to be assessing accommodation. Go ahead and look over my shoulder, and then look at the tip of the pen. Excellent. So there's constriction of the pupils bilaterally. Next, we'll be assessing cranial nerves 3, 4, and 6, the ocular, motor, trochlear, and the abducens, by having the patient go through the 6 cardinal fields of gaze. Go ahead and look at my finger and follow it. Excellent. And lastly, convergence. Excellent. So no extraocular movements noted there. Next, we're going to be assessing for any strabismus with the cover and uncover test. So go ahead and cover your right eye and uncover. Excellent. And do the same with the other side. Cover and uncover. Excellent. So no strabismus noted bilaterally. Next, I'm going to be looking at Michael's red reflex with the otoscope. Go ahead and look right over my shoulder. Good. So red reflex is present. And then on this side. And red reflex is also present. So cranial nerves 3, 4, and 6 are all intact. Next, moving on to Michael's ears. Inspection of the ears, they are symmetrically placed on both sides of the head. The auricles line up with the outer canthus of both eyes. The auricles are the same color as the facial skin. No signs of any external ear drainage. Palpating the auricles, they're mobile, non-tender, free of any nodules. Now inspecting the inner ear. So the inner ear canal, there's no redness or any cerumen noted. The tympanic membrane is visualized. It's a pearly gray, no signs of any perforations, and the red reflex is present. And on this side, same thing, the ear canal, no sign of any redness. There are slight cerumen, but the tympanic membrane is visualized. It's a pearly gray, no perforations, and the light reflex is present. Moving on, we're going to be testing some of Michael's hearing first with the whisper test. So go ahead and plug your left ear, and close your eyes, and just repeat what I say.
Bear.
Excellent. And on the other side.
Dog.
Excellent. Now using the tuning fork, we're going to be doing the Weber test, assessing for unilateral hearing. So just let me know if you hear the tone in both ears.
Yes.
Excellent. And now the Rin test, let me know when you stop hearing the tone.
No. No.
Good. And on the other side.
No. No.
Excellent. So air conduction was longer than bone conduction, which is a normal finding. Next, I'm going to be inspecting Michael's nose. The nose is symmetrically placed. It is midline, good in color. The nares are symmetrically oval, no signs of any nasal flaring. Palpating the nose is smooth, no tenderness, there's a slight bump noted. Go ahead and plug one nostril and take a deep breath in and out. Good, and on the other side. Excellent. So nasal patency is noted. If the patient was having any difficulty with smells, we could further assess cranial nerve 1, the olfactory nerve, by having the patient close his eyes, plug one nostril, and differentiate between smells such as coffee and peppermint. Since Michael is not having any of those complaints, we will say cranial nerve 1, the olfactory nerve, is intact. Next, I'm going to be inspecting the nose with the otoscope. Go ahead and lean your head slightly back. Good, so the nasal mucosa is pink and moist. The turbinates, the turbinates are the same color as the surrounding tissue, no swelling noted, and the septum is midline, no perforations or any bleeding. So again, on this side, the nasal mucosa is a nice moist pink. The turbinates are the same color as the surrounding tissue, no swelling. The septum is midline, no perforations or bleeding noted. Next, moving on to Michael's mouth, inspection of the mouth. The lips are symmetrical, they're pink, no lesions or any cracking noted. Go ahead and open your mouth. So inspection of the buccal mucosa, it's a pink, moist, no signs of any lesions. There are 32 ivory white teeth with some slight wear. There are tight margins, the gums have tight margins with the teeth. Inspecting the floor and the side of the mouth, again, no lesions. Inspecting Michael's tongue, stick your tongue out. The tongue is a deeper pink, it's slightly rough, moist. Go ahead and lift the tongue up. The ventral aspect of the tongue is a smoother pink, and the frenulum is present. Go ahead and tip your head back, open your mouth. So inspection, the hard palate is intact, the soft palate is intact and continuous with the hard palate. Say ah.
Ah.
The uvula is midline, tonsils are present, they're a 1+. Anterior and posterior pillars are present, no signs of any infection, redness or drainage. The posterior pharynx is a glistening pink and there's no odor noted. Next, I'm going to be assessing cranial nerve 10, the vagus nerve. This also assesses the motor function of cranial nerve 9, the glossopharyngeal. Go ahead and open your mouth and say ah. So again, there's symmetrical rise and fall of the soft palate. The uvula remains midline and the gag reflex is present. Go ahead and swallow for me. So patient swallowed easily as well. So cranial nerve 9 and 10 are intact. Next, we're going to be assessing the hypoglossal nerve by having Michael stick out his tongue. So tongue is again midline, no tremors noted. Tongue back in your mouth and push against my cheek, my hand, and on this side. Stick your tongue out and down towards your chin and up towards your nose. Excellent. So cranial nerve 12, the hypoglossal nerve, is also intact. Moving on to the neck, inspecting Michael's neck, there is a symmetrical musculature, no signs of any swelling or masses, no sign of any obvious jugular venous dissension or carotid artery prominence. Next, we're going to have him move through some range of motion exercises. First, passive range of motion, put your chin to your chest and back up straight. Look to your right and then to your left. And tilt your right head or your right ear to your right shoulder, left ear to left shoulder, and tip your head back. Excellent. Now some active range of motion. Go ahead and shrug your shoulders against my hands. Twist your head to my hand on this side. Excellent. Now assessing the musculoskeletal portion of the cervical spine. Push your head to there, then and back. Excellent. So assessing cranial nerve 11, the spinal accessory nerve was also intact. Next, I'm going to be palpating the carotid arteries one at a time. Good. Carotid arteries are strong and regular bilaterally. Palpating the trachea. Trachea is midline, there's no tugging present. Palpating Michael's thyroid. Go ahead and swallow. Good, and one more time. Good. So palpating both lobes of the thyroid and no nodules were present. Next, I'm going to be palpating some of your lymph nodes. Go ahead and tip your head back slightly. So palpating the occipital nodes, postauricular, preauricular, tonsillar, submandibular, and submental. Your anterior superficial cervical chain, posterior cervical chain. Good. Turn your head. Deep cervical chain, deep cervical chain on this side. Supraclavicular and infraclavicular. There's axillary nodes, and then axillary nodes on this side as well. Excellent. So no tenderness present there. Lastly, I'm going to be auscultating the carotid arteries for any breweries with the bell of the stethoscope, and then the thyroid for any breweries again with the bell of the stethoscope. Take a deep breath in and hold it. Excellent. So no breweries noted there. Moving on to the upper extremities. The upper extremities are equal in length and musculature. Their hair is evenly distributed. Skin is warm, dry, and intact. The nail beds are uniformly pink. Nail plates are smooth and hard, and nail base is firm. No evidence of any clubbing. Cap refill is brisk, less than 3 seconds. Palpating your radial arteries, strong and equal bilaterally, and the brachial arteries are also strong and equal bilaterally. Moving on to Michael's back, we'll have you turn to the side. Inspection of the back. Skin is clear and intact, no signs of any obvious skeletal deformities. The AP diameter is less than the lateral diameter. Palpating the back for any tenderness or skeletal deformities, which none are noted. Percussing the costrovertebral angle for any signs of tenderness, and none noted there. Next, going to be moving on and inspecting the posterior in terms of respiratory. There's symmetrical rise and fall of the chest. Again, the skin is clear and intact. No obvious signs of any skeletal deformities. His respirations are even and non-labored at a regular rate. I'll turn a little bit further. Good. So Now assessing thoracic expansion, take a deep breath in and out. Good. And assessing tactile fremitus, just repeat 99.
99, 99, 99, 99, 99.
Excellent. So tactile fremitus was equal. Next I'm going to be percussing the posterior and lateral. So go ahead and lean forward and give yourself a hug. And now the lateral, go ahead and lift this arm up. And on the other side. Excellent. Next will be percussing for diaphragmatic excursion. Go ahead and take a deep breath in and hold it. Excellent. And so I will mark that area. And then go ahead and take a couple normal breaths and then exhale completely. Good. So I mark that area as well. And I'll grab my tape measure. And I'll measure the markings here. So diaphragmatic excursion was about 4.5 centimeters, which is a normal finding. For the sake of time, we're just going to do one side. Moving on to auscultating the posterior with the diaphragm. Just take some nice breaths in and out. Do the lateral chest as well. Good, and the same on the other side. Excellent. So no adventitious breath sounds noted. Lungs were clear bilaterally. Moving on, go ahead and turn forward. Inspecting the anterior chest in terms of respiratory status. Again, inspecting the anterior chest. Skin is clear and intact, no signs of any obvious skeletal deformities. Respirations are even and non-labored and at a normal rate. Going to palpate for thoracic expansion again on the anterior chest, deep breath in and out. Good. And now palpating for tactile fremitus again. 99.
99, 99, 99, 99. 99.
Excellent. So tactile fremitus was again equal. And now I'm going to percuss the anterior chest. Excellent. And lastly, we will be auscultating the anterior chest. Just some nice deep breaths again. Excellent. So no adventitious breath sounds noted. Lungs were clear bilaterally. Next, I'm going to be inspecting the anterior chest in terms of cardiac. Inspecting the chest again, similar to respiratory. Skin is clear and intact. No obvious skeletal deformities. No pulsations or any heaves noted. Next, I'm going to be palpating the precordium. So first, palpating the apical, the apex, left sternal border, and the base. No thrills noted there. Now palpating the apical pulse. No heaves or lifts noted. Lastly, we're going to be auscultating the cardiac portion. Normally you would do with the bell and the diaphragm. For sake of time, I'm just going to listen to with the diaphragm with the patient sitting slightly lean forward. A little bit, there you go. Second intercostal space, right sternal border, spatral. Second intercostal space, left sternal border is pulmonic. Third intercostal space, left sternal border is Erb's point. fourth intercostal space, lower left sternal border, tricuspid, and lastly, fifth intercostal space, midclavicular line is the mitral valve. So S1 and S2 were noted, no evidence of any murmurs. Next, I'm going to have the patient lie back and we're going to inspect the abdomen. So inspection of the abdomen, abdomen is flat, skin is clear and intact, there is symmetrical contour, no peristalsis or pulsations noted. The umbilicus is midline and inverted, which is normal. Next, I'm going to be auscultating the abdomen with the diaphragm. So auscultating in all four quadrants. And now with the bell, auscultating the aorta, the renal arteries, the iliac arteries, and lastly the femoral arteries. Excellent, so no breweries noted there. Next I'm going to be percussing the abdomen. And no abnormalities noted. Next we're going to be percussing the liver border at the right margin first. Excellent, and then down from the right margin as well. And we would measure again with our measuring tape. So Michael's is about 8 centimeters, which is a normal finding. You would then do percussing as well on mid-sternal. Next I'm going to be percussing the splenic border. Excellent, so no abnormalities noted there. Lastly, we will be palpating the abdomen. First light palpation, looking for any muscle tenderness, which none is noted there. Next, deep palpation by manual. No grimacing or any other signs of pain. Next, I'm going to be palpating for the liver. Go ahead and take a deep breath in and out. Good. And now we will be palpating for the spleen. So the liver was palpated when the patient took a deep breath in. Good. So unable to palpate the spleen, which is a normal finding. Next, we'll be palpating the left kidney. Good. No masses or tenderness in the right kidney. Good. No masses or tenderness noted there. Lastly, I'm going to be palpating the aortic pulsation here. And no lateral pulsations noted. Go ahead and lift your head up slightly. Good, so there's good musculature of the abdomen, no separation noted. Go ahead and sit up. Go ahead and sit up. And uncross your legs. So now inspecting the patient's legs. Now inspecting the patient's legs, they're symmetrical. The musculature is symmetrical as well. They are warm and no change in temperature or color. Inspecting the patient's nail beds, they are uniformly pink. There's no clubbing. The nail plate is soft and hard. Nail base is firm, and the cap refill is brisk, less than 3 seconds. Next, I'm going to be moving this down so we can see better. And palpating the popliteal behind the knee. Good, and on the other side as well. So now palpating the popliteal artery on both sides. The dorsalis pedis on the top of the feet, and the posterior tibialis. So pulses are strong and equal bilaterally. Next, moving on to the musculoskeletal portion. First, I'm going to be assessing some of Michael's reflexes, starting with the brachial radial reflex. Good, and this side. Good, and now the patellar reflex. Good, and on this side as well. Excellent. And lastly, the Achilles. Good, and one more. Good. And now assessing the musculoskeletal portion of the lumbar and thoracic spine, since we already assessed the cervical spine previously. So again, inspecting the back. The cervical spine and the lumbar spine are concave and the thoracic spine is slightly convex. No obvious signs of any skeletal deformities. The iliac crests are equal and palpating down the spine. No deformities, and palpating the musculature as well. Excellent. So go ahead and stand up. First, we're going to have the patient lean backwards. Good. And then right arm towards your right knee, left arm towards your left knee. Good. And then twisting to the right, and then twisting to the left. Excellent. And then turning towards, with your back towards me, and then bending down, touching the toes. Again, you can see that the spine is straight and no deformities. Excellent. Stand up. You can go ahead and have a seat. And that concludes this video. Thank you so much for watching.